428th meeting of the Texas Animal Health Commission is now called to order, and the time is 8:30. And I ask that we now stand for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, liberty and justice for all.
Before I take roll, I want to welcome our new commissioner, Mr. Ben Schultz. I had a chance to spend the day with him yesterday and very much enjoyed getting to know him. And I think everybody's going to really enjoy having him on board, and we welcome you. And you've probably met everybody this morning.
Well, I'm not sure I've met everybody, but we're getting.
We'll give you a test. You're welcome, and we're very, very happy to have you. I will now take roll and call the roll of commission members. Coleman Locke Chairman here, Jimmy Ruth Evans.
Here.
Ben Schultz. Here. Ken Jordan. Here. Barrett Klein. Here. Wendy Payne.
Here.
Joe Leathers.
Here.
Tommy Otis.
Here.
Joseph Osterkamp. Here. TJ Klein.
Here.
Ben Turner.
Here.
Johnny Trotter.
Here.
Keenan Sturgis. Here. For one time, we're all present and accounted for, and we don't have to excuse any absences. Next item on the agenda will be a closed session to receive legal advice, discuss pending or contemplated litigation and settlement offers as permitted by section 551.071 of the Texas Government Code, and close executive session to deliberate the appointment, employment, evaluation, reassignment duties, discipline, or dismissal of specific commission employees as permitted by section 551.074 of the Texas Government Code. We will now go into executive session at this time, and it is 8:32. Okay, our closed executive session ended at 9:33, and we're back in open session at this time. And the next item on the agenda is to approve the minutes of the 427th meeting. And before I go any further, since we're in public, I want to welcome our brand new commissioner, Commissioner Schultz. Raise your hand so they can see who you are. And I want to congratulate all of you who are reappointed. We have a number of y'all that were reappointed to another term. So welcome back. We're proud to have y'all back. Y'all are very needed. Okay, the next item on the agenda will be to consider the approval of the minutes of the 427th meeting.
Mr. Chairman, I move we approve the minutes of the 427th commission meetings.
Second. Okay, we have a motion and a second to approve the minutes. Is there any discussion or are there any questions? If not, everyone, please signify by saying aye. Approval, by saying aye.
Aye.
Opposed by no, and the motion passes unanimously. And the next item will be a report of the executive director. Agency Operations and Affairs, National Update, waivers and variances, and acceptance of gifts and donations. Welcome, Dr. Davis.
Good morning, Chairman. Good morning, Commissioners, and welcome to you, Commissioner Schultz, for serving in your capacity there. So certainly a pleasure to have you on board. So my pleasure to give my report to the commission this morning. I know my oral reports have been somewhat lengthy in the past, and I'll do my best to keep those somewhat short to the point today. So I'll start off with Agency Operations and Affairs. We've talked about the Veterinary Medical Education Loan Repayment Programs before. I'll first start out with the federally funded Veterinary Medical Education Loan Repayment Program, BMRP. As you recall, those funds were paused and federal funding was under review early part of 2025. So that application cycle for 2025 was put on hold. The Animal Health Commission, or the state of Texas rather, was afforded or awarded 8 shortage areas for that application cycle. Since those shortage areas were then moved forward to the 2026 fiscal year, we had veterinarians apply for that program back in January and February this year. And then, applications were completed January, March of 2026 for that program. The USDA staff is currently reviewing the applications, and awards will be offered sometime in September of 26. In the meantime, Elm Health Commission will work on a working group. We'll put together combined of veterinary practitioners, industry stakeholders, and vet school staff and leadership, and put together a working group that will come up with shortage areas for the application period of fiscal year 2027. Those shortage areas will need to be submitted to USDA in October and November of this year. So we'll work toward that. Now to the state-funded Rural Veterinary Incentive Program. The funding was appropriated by the 98 or 89th legislature in the tune of $5 million for the biennium. The RVIP committee met last September and set the application period for September 22nd through November the 30th. There were 91 applicants submitted to the committee. Committee members reviewed and scored the applications independently. Then we met in March to discuss and decide on the awards. The committee awarded 22 applicants with roughly $2.8 million of veterinary student loan debt to be repaid. So the breakout is there in your report. There are 4 2022 graduates, 2 2024 graduates. There's 13 graduates from the class of 2025. And then there were 3 awards granted to graduates from this year from the colleges of veterinary medicine here in the state of Texas. There are also 4 alternates selected in case one of the awardees were declined their award. So we will, our legal staff will work with the state board of Texas Higher Education Coordinating Board. And once we get the agreements and the funds distributed, we will report back to you as to what counties those reward recipients will serve, and give you more accurate information on what the impact that those awardees will have on the state's veterinary profession. I will update you now on the high path avian influenza premises that we had back in December in Shelby County. In March of this year, that premises passed the biosecurity compliance audit. It was eligible for quarantine release and able to be restocked at that time. That premises was restocked in April 27th of this year, and I believe this next Monday, the 18th, that premises will complete post-placement testing. So certainly good news there. As far as cattle fever ticks go, we've mentioned in the past the cattle fever tick treatment, the Prenamectin field trials that we've looked at, looking at repeated dose regimens for injectable Prenamectin to see if they can be effectively control fever tick infestations. We've worked with the USDA ARS with some of those trials. USDA has taken the information gained from our research early on in the program, and they continued the exploration of effective and single Prenamectin repeat dose regimens. And research manuscript will incorporate information on the performance of the study dosing regimens from the start of the research until the conclusion of the USDA's second trial. So that work has been slowed due to the USDA's subject matter expert, their involvement in the new world screwworm preparation activities. So that's what we're saying on that. The second phase of that Prenamectin study to evaluate the residue levels created by the treatment regimens. That work has begun at Texas A&M at the Animal Science Department. The collaborators will incorporate the findings into FARAD, food animal residue avoidance database models to determine withdrawal recommendations associated with repeated dosing of the Prenamectin. That study will run a minimum of 280 days. There are 25 animals involved in that study. It is my understanding that the primary investigator has to adjust the animal use protocol. And once that animal use protocol is adjusted, that they can begin with that study. So as far as Asian longhorn ticks are concerned, was not able to make the monthly update this last month due to scheduling. I mentioned before that responsibility for that update has transitioned from the USDA APHIS to the medical and veterinary entomology team there at the University of Tennessee at Knoxville. And I visited with the folks that manage that monthly report, and they're going to get that out as soon as their academic semester winds up right now. So we'll get that report. There's not much to report on that front. The tick has been found to date, 26 states in the Washington, D.C. area. Tick has also been found in northeast Oklahoma and northwest Arkansas. The affected states continue to use producer education and outreach to mitigate the risk of introductions. I am happy to inform you or remind you that the 89th legislature funded our THC exceptional item to create a THC ectoparasite field identification laboratory. I am pleased to welcome today Dr. Nicole or Renee Holmes, our new entomologist here with us. Yesterday was her first day. And a little bit about Dr. Holmes. She's completed the Aggie trifecta. She has a bachelor's degree in entomology, a master's degree in veterinary public health, the epidemiology emphasis. She has a PhD from entomology from Texas A&M as well. So welcome, Dr. Holmes. Her family ranches in South Texas, run cattle and raise horses. So we're certainly happy to have her on board, and she's hit the ground running, and we'll get us set up in the ectoparasite field identification program. So now on to a subject that's been on our minds for several years now, unfortunately, New World screwworms. As of May 11th, Seneca reports that there were 24,047 total cases of New World screwworms, with 1,709 of those considered to be active in Mexico. The northernmost case has been found 62 miles of the Texas-U.S. border. There in Nuevo Leon, that was a 1-month-old calf with an umbilical lesion that was reported back on April the 19th. On April the 18th, Seneca reported that a fertile New World screwworm fly had been captured in a trap in Coahuila, Mexico. That was the first detection of the New World screwworm fly in that state, and that was located approximately 173 miles from the U.S. border. The next day, they reported a case of New World screwworm myiasis detected in Coahuila there. That was in a 36-month-old bovine with a brandy lesion. That was approximately 119 miles from the U.S.-Mexico border. So to date, there have been 25 Mexican states with New World screwworm detections. Sterile fly dispersal polygons have been adjusted to cover this activity. And it appears that from looking at the numbers that potentially 23 states in Mexico have established New World screwworm adult fly populations. As of May 1st, there have been 276 human cases reported in Mexico, with 2 deaths being reported. As far as the USDA update, you can go on to screwworm.gov, and see these numbers. The USDA updates them every Tuesday. It closes business every Tuesday and Thursday. These numbers are a little behind what's reported at Seneca. So as of May the 6th, there were 23,091 cases reported, with 1,702 of those being considered active in Mexico, reported by the USDA. Like I said, I think they like to kind of follow up on what Seneca reports and verify somewhat best they can the cases that they're being reported. So due to the discovery of New World screwworms at Tamaulipas in the latter part of December, and then the movement of cases into Nuevo Leon and now into Coahuila. Back in February, the dispersal grids, they started dispersing sterile flies in South Texas there in 8 counties, in all part of 8 counties there. Another adjustment to the dispersal grids were made after the discovery there in Nuevo Leon in April. Since then, they've started deploying ground release chambers. They've got, I think, 4 sites for ground release chambers in Zapata and Webb counties. They've also started using a ground release vehicle, a truck that they've got that we'll talk more about that in a minute. But they started using that to disperse some of the flies from the dispersal center there at Moore Air Base along the river at the U.S. Fish and Wildlife Services property there along the border. So just a couple of things the USDA is doing there. Keep in mind that when we first started out back in, I guess, the end of July last year, doing surveillance, fly surveillance, they had 8 Texas counties. They had 101 traps. Every time they've adjusted those traps, we've had to readjust the trap lines and decrease the numbers of traps. But the traps have to be placed at least 9 miles north of the northern edge of the dispersal polygon. So that's kind of what's had to take place since the dispersal polygons have been adjusted. Just to give you an update, as of April the 28th, there's been 52,310 individual flies submitted to NDSL. 51,614 of those flies are confirmed to be negative, and they're not New World screwworm flies. And those efforts continue along the southern border in New Mexico, Arizona, and California. There are 5 traps in New Mexico, 7 in Arizona, and 8 traps in California being monitored, surveilled. So on May 6th, due to the increase in the number of cases in Tamaulipas and Nuevo Leon and the recent discoveries in Coahuila, USDA Veterinary Services adjusted the sterile fly dispersal polygon to include the northern parts of Mexico for the Mexican border states, Tamaulipas, Nuevo Leon, and Coahuila. The new dispersal grid will now include all the parts of Maverick, Emmett, Webb, Jim Hogg, Star, Hidalgo, Willacy, Cameron counties in South Texas. So we've been looking at our folks, the management there in the Laredo region have been looking at the realignment of the trap lines in that area. We'll talk more about those in just a minute, but also on April the 8th, the USDA put out the New World Screwworm Playbook, the second version. It's a comprehensive guide to support coordinated and science-based action should New World screwworms be detected in the United States. The USDA worked to gather feedback from state animal health officials, federal partners, livestock and wildlife industry groups, tribal partners, veterinary organizations, and other key stakeholders to prepare the updated version. To ensure continued alignment with state level plans and industry practices, APHIS will continue to revise the playbook as prepared its activities advance and evolve. So we've got that to look forward to. As far as the domestic dispersal facility there at Moore Air Base in Edinburgh, recall that on February the 9th, Secretary Rollins and Governor Abbott hosted a ribbon cutting. The facility has been receiving pay from COPEG for training purposes, demonstration purposes, and also they wanted to look at the ground release truck that's being used now currently along the border there. They wanted to validate that process. And then beginning on, they started dispersing those flies on April the 17th. Beginning on April the 29th, they began using pupae out of the Moore Air Base facility there to supply the ground release chambers there in Webb and Zapata counties. As far as the domestic production facility goes, that award contract was awarded on March 9th by the USDA and the U.S. Army Corps of Engineers. And then on April the 17th, the USDA hosted a groundbreaking ceremony there at Moore Air Base with the U.S. Army Corps of Engineers. That production facility is tentatively scheduled to begin operation in November of 2027, initially producing 100 million sterile flies, and will eventually produce 300 million sterile flies. As far as what we've been doing in Texas, an update on that. From April the 12th through April the 18th, I was able to accompany the USDA APHIS Veterinary Services Regionalization Evaluation Services on an APHIS site visit to Mexico to evaluate New World screwworm activities. Specifically, we visited the state of Chihuahua to review animal movement controls, New World screw mitigation activities. While we were there, we visited feed yards, slaughter facilities, ports of entry to the states, or to the state there rather, and then quarantine stations associated with those ports of entry. There is another site visit scheduled. It's in the planning stages now for June. I think that will be taken to the state of Coahuila. So, like I mentioned before, as far as the New World Screw specific sticky trap surveillance, we continue with that. We continue to change those trap lines and locations as they adjust the dispersal polygons. THC will certainly assist in identifying new trap locations on the trap line, help to execute landowner agreements, and will service these traps going forward. Today, the thinking is that we'll have 34 traps in 9 counties there in South Texas. We will continue to manage 19 traps that are in Brooks and Kennedy County until we get this other trap line in place. And then I think the SEPTEP folks will manage 19 traps in 3 other counties there in South Texas. So Texas Animal Health Commission continues our New World Scrutiny planning and preparedness activities. Our weekly and bi-weekly communication, coordination, and collaboration calls are ongoing. Internal and external working groups continue to work on response plans, focusing on animal movement control, treatment, and surveillance. Dr. Lancer and I continue to correspond with the NASAHO working group, New World Screwworm working group. Emergency management staff has been really busy. They conducted an animal movement checkpoint exercise on March the 25th. This tested the agency's ability to permit animals and verify livestock were moving with the proper paperwork as they were stopped at a checkpoint. So beginning on April 20th, the emergency management staff and our secure food supply staff have attended 3 to 4 livestock markets each week. I think in the last week, they had visited all the livestock markets in the Laredo and Pleasanton regions. And staffs were setting up booths, hand out information, both in English and Spanish, and worked with with producers and answered any questions they may have regarding New World screwworms. Since April 1st, our emergency management staff has met with our internal New World screwworm incident management team on a weekly basis. They are working on building out the incident management structure, or incident management team structure, verifying roles and responsibilities, and reviewing initial response operations. They've also met with Texas Parks and Wildlife to go over the incident command system structure. The emergency management staff has worked with Department of Home or DSHS, Department of State Health Services, on training for county and municipal animal control officers. This training will take place tomorrow, if I'm not mistaken. So education and outreach efforts to raise awareness continue to be conducted. We continue to participate in New World Screwworm producer and veterinary education meetings in both state and around the nation. We also accept every opportunity to present on New World Screwworms at county government and county emergency management meetings. Work with Texas Parks and Wildlife, both individually via weekly coordination calls through the New World Screwworm response team is ongoing. Texas Animal Health Commission New World Screwworm response team with the mission to amplify the New World Screwworm preparedness in Texas and serve as a central hub for coordinating information, aligning strategies, and delivering resources to support prevention, detection, control, and eradication efforts. This response team held its first meeting back in September of last year. We do have a second or next response team meeting. The World Screwworm response team meeting is scheduled for the week of Friday, May the 22nd. Texas Animal Health Committee continues to update and distribute producer guidance documents since the reported case in Nuevo Leon in September 2025. And in the most recent case, there's just 62 miles from the southern border. And also in Nuevo Leon on April the 19th, we have bolstered communication efforts with county judges, emergency management personnel, livestock deputies in numerous South Texas counties. We've also increased awareness among the South Texas livestock market owners and management. This week's a busy week as far as New World Screwworm response preparation goes. Yesterday, we provided testimony to this Texas State Senate Committee on Water, Agriculture, and Rural Affairs. on New World screwworms to include the agency's response preparation and also include future response needs. On Thursday this week, we will have a response discussion plan with, have that plan with USDA APHIS Veterinary Services here in Texas, USDA APHIS National Preparedness and Incident Coordination folks that are stationed here in Austin, Texas Parks and Wildlife, and also the USDA Wildlife Services. On May the 15th, we're scheduled to participate in a virtual tabletop exercise with the state of Arizona. And then on Sunday, May the 17th, we'll participate in the New World Screwworm Continuity of Business Workshop for livestock markets and dealers at the livestock, live oak livestock auction. As far as FDA, they've been busy approving tools that have in our toolbox to treat and prevent the New World screwworms. On March the 10th, they approved F10 antiseptic wound spray and insecticide. It's both effective in prevention and treatment for New World screwworm in cattle, horses, minor species such as sheep, goats, and deer. Also may be used in raptors and other wild birds. This wound spray may not be used in domestic dogs and cats. To that date, New World or FDA had conditionally approved and issued emergency use authorization and conditionally approved authorizations for drugs to prevent, treat New World screwworms in cattle, horses, and dogs. So that's certainly another tool in our toolbox that can be used in other species. So thank you to the FDA for doing that. The milk and meat withdrawals are listed there in the report. The F10 antiseptic wound spray will be available over the counter. In the month of April, they approved the F10 barrier ointment with insecticide, which has the same active ingredients, pretty much can be used in the same species that I listed with the antiseptic spray. That product too will be available over the counter without prescription. So on April the 27th, USDA issued emergency use authorization of Magnesium powder, which is a coumaphos, which we use to dip cattle with, organophosphate, and then Propoxur, which is an insecticide, and then it also contains a sulfonamide to help with bacterial infections in the wound. This product, it's powder. They do have aerosol spray, Magnesium aerosol spray that they use in Mexico that I saw on my trip down there. But this is may be effective for prevention and treatment of New World screwworm in cattle, swine, goats, sheep, horses, donkeys, domestic mules, and other captive wild and exotic and zoo animals. So definitely happy that they've approved that. It's been used widely in Mexico and Central America in the treatment and control of the New World screwworm and associated wounds. So it's my understanding that that product will be distributed to the National Veterinary Stockpile. And then if we do have incursions here in the United States, that product will be distributed through that to state and federal partners and then ultimately down to private practitioners and can be used by producers under the guidance of private practitioners. So obviously there is a concern that the two active ingredients cause some neurotoxicity. So definitely there are requirements for people, animals, and the environment when that's being used. The withdrawal, milk and meat withdrawals are in the report there. The EPA also issued a emergency exemption for Tanadil, which is pretty much the same product as Nagisont without the sulfonamides. So this is, I guess, considered a insecticide by the EPA. So they did issue the emergency exemption. That product is currently manufactured in Brazil. It will take approximately 90 to 100 days to get that product relabeled and sent to the states here. That product, as far as I'm aware, will be available through the National Veterinary Stockpile as well. So certainly appreciate the FDA's continued efforts to approve products as well as the EPA get those products to us to treat New World screwworms. Texas Animal Health Commissions, we do continue our monthly calls with the FDA. Myself, Dr. Lanchford, we have Dr. Kaufman from A&M and Dr. Ellis from A&M are on those calls as well. Unfortunately, the FDA is not able, with the laws the way they are, not able to let us know what companies are petitioning products and not able to let us know what products they're being considered for approval. So we find out about the time everybody else does what's going to be approved or granted emergency use authorizations or conditional approval. So with that said, on to our high path avian influenza. The outbreak currently in poultry since February 8th of 2022. To date, over 206 million birds have been affected. Nationwide, 2,204 premises in 50 states and Puerto Rico. Texas, we have had 20 total HPI positive premises since February 22. That includes 3 commercial flocks totaling 2.155 million birds. With our latest premises that was affected was a backyard flock in Carson County back in January of this year. On the dairy high path situation, currently there are 20 states with 1,095 confirmed premises. Texas, since the start in March of 24, have had 30 premises overall, with our last known test positive premise showing clinical signs back in December of 2024. We've got some information there in the report on the National Milk Surveillance Program. Also touch on the National Milk Testing Strategy and the different stages of that. So I've got some good news. I'll remind you that Texas began the National Milk Testing Strategy April 7th of 2025 by conducting plant silo monitoring. The Department of State Health Services administers the pasteurized milk ordinance established by the FDA and is conducting those samplings for the Animal Health Commission and the state. Dr. Mundy, state epidemiologist, submitted THC's National Milk Testing Strategy annual work report to the USDA earlier this year. And using the results from that report and continued testing, USDA has changed our can't speak this morning, obviously, HPAI status in the state of Texas to unaffected as of March 27th, 2026. This change in status eliminates the testing requirement for Texas origin lactating dairy cattle prior to moving interstate. Also, the unaffected status allows us to eliminate the need to continue testing Texas origin lactating dairy cattle that will participate in an interstate livestock show. For now, the silo testing will continue. We hope that USDA may adjust that to quarterly testing, but that yet to be determined. So that completes my report. There are waivers, variances, Commissioner or Chairman, that are an action item. And then what's a deal with those? We will deal with the approval of the gifts, grants, and donations, if that's okay. And I can answer any questions you have as far as your report.
I've got, I mean, this real quickly. Has there been any more talk or movement on two things, where the New World Screwworm is concerned? We've talked in the past a little bit about companion animals and obviously you think of Fluffy going down the road with somebody, but my thought process is more toward the bird dogs in South Texas that quail hunt, and then deer that's harvested, removing them from the premises where there might potentially be screwworms and taking to some other county.
Yes, right. I know Texas Parks and Wildlife is our partner in this, and I'm fairly certain that they are distributing information to landowners and hunters alike in South Texas to address those issues. I'll double check, make sure, but we'll make sure that they're taking care of those two issues.
Is there any update on the border and checking companion animals? Talk about that.
So, our local management there in Laredo have conducted training sessions with the Customs and Border Protection there along the border. So that's kind of how we're addressing that. It's in the rules and regulations that animals coming out of Mexico have to have a CVI issued by a Mexican accredited veterinarian within 5 days. Don't know how much of that verification is going on, but we've certainly made the CBP. We have pretty good relationships with those folks there along the border, and we've addressed that on our side to make sure that they have questions answered, and we've actually gone down and trained those individuals. Any other questions or comments?
Mr. Chairman, I move that we approve the waiver and request and variances as presented today.
Do I have a second? Second. Okay, we have a motion with second to approve the waivers and variances as presented. Is there any discussion or are there any questions? Not all in favor of the motion, please signify by saying aye.
Aye.
Opposed by no. Motion passes unanimously.
Chairman, I have one other item to address there. It's approval of grants, gifts, and donations. Had our region director there, Dr. Sandra Leyendecker of Laredo. She donated a trailer to the Animal Health Commission to be used as part of the agency's emergency response efforts. This trailer has an appraised value of $2,500. And in accordance with the commission rule 56.3, because of the value of the gift exceeding $500, the commission is required to vote to accept this gift. This gift has been reviewed by legal counsel and complies with the requirements of the commission rules and state law. And I ask the commission to approve this gift.
Do I hear a motion?
Mr. Chairman, I move that we approve the acceptance of the gift and donation presented today.
Second.
Okay, we have a motion and a second to accept the gift. Any discussion or further questions? Not all in favor of the motion, please signify by saying aye. Opposed by no. The motion passes unanimously. Thank you very much, and will you
Thank you.
please thank them for the donation?
Absolutely. That.
Next item on the agenda will be field animal health programs and disease traceability activities. Dr. P.R. Lampkin. Good morning, sir.
Morning, Chairman, Commissioners. Always a pleasure to have the opportunity to share a few things about the goings on at many different departments, to include not only animal disease traceability, emergency management, program records and quality assurance, but we'll also now have some things to add about the training department and our ectoparasite department. So lots of good things happening. So we'll jump right in. And they told me I was on my own with technology, so we'll see how that works. But anyway, so to jump into animal disease traceability, here's our latest numbers related to what's going on in terms of assignment of pins and lids. As you can tell there, we're up a little bit compared to the last quarter, at least in terms of the assignment of lids, location IDs, not necessarily premise IDs. And so that just goes along to show that that's still steady. It's the same with our scrapie flock IDs. It's down a little bit over the last quarter, but if you look across the last couple of years or so, it's pretty steady there. So, which is good, because that means that producers are still getting the word that those things need to happen, and that they need to highly encourage them to apply for those and get those premise IDs. Not only for the scrapie side for movement purposes, but in the event we have to do a disease outbreak of some kind and trace animals, and that'll put us a long way down the road to already have those location IDs and PIN numbers assigned. So in terms of tags, the noose tags, I'll touch on that real quick before we move to the RFIDs, but we have received, like I mentioned at the last commission meeting, we received all of the noose tags, the metal clips, that were in the Kansas City warehouse, and also from our partners here locally at the Austin office, the ES office. And we have those. We are at the point of getting close to the end of that inventory. We will probably be done issuing or be through issuing any of those tags, most of which are going to markets that are identifying adult cattle that are ending up in slaughter channels in the state. We'll be through with that probably at the end of August. So at the end of the fiscal year, we'll probably be out of tags, metal tags distributed at that point. That what will be left will be RFID tags, no cost RFID tags. So we'll have to adjust that and see where we end up with on that. But that's good news, because one other thing related to OCD or to news tags is in the last couple of weeks, there's been some discussion about the orange clips, the official capsid vaccination clips. USDA did a clarification in 9 CFR 78 that has to do with identification of 4 official capsid vaccinations of brucellosis. And said that those metal clips are still considered official ID for the purposes of official calf foot vaccination in the state that they're applied. But if you're going to move those animals out of state, then they have to have an RFID to meet the requirement in 9 CFR 86 for visually and electronically readable tags. So the bottom line is in Texas, we know that there's a number of those tags still out there and certainly probably being applied for in-state animals. Our encouragement continues to be with veterinary practitioners to please start using the no-cost RFID tags, and certainly we can get them to them and provide those for their use. So just wanted to make you aware that there has been some discussion about that. I think there's some other states in the Yellowstone area that have some challenges with some of those things, and it's been interesting to kind of watch that unfold. So looking at the RFID numbers, certainly we continue to distribute those. Again, maybe down a little bit over since the last quarter, but again, if you look across the line, it's a pretty steady distribution of tags there. We have not received quite all of our additional allotment from USDA from last year, but we're supposed to be getting those, and then we'll find out when we start getting our allotments for the current year. So all that said, we're in good stead in terms of inventory of tags, and certainly tell your friends and certainly encourage them to request tags. We've got plenty of them to send out and get IDs and cattle. So moving on to outreach, electronic reader distribution. Matt continues to do a great job working with our veterinary practitioners, authorized veterinarians, not only getting readers into their hands, but supporting the technology and issues that go along with that sometimes to help work through those problems. And you can see on the map here, got 290 readers into the hands of accredited veterinarians, and certainly have plans to purchase some more of those readers and continue that effort moving forward through the funding from USDA and our ADT cooperative. So our communications and authorized personnel program certainly continue to help us get the word out about ADT and readers, and appreciate all the work on that, and certainly appreciate all of the work of the veterinary practitioners in the state to adapt that technology and move forward with RFID. So last thing on ADT is we did fill our other program specialist position, and I want to welcome Casey Gray into that position. She came from some couple of 3 years in program records, and certainly brings some expertise in the data systems that will be very valuable in her role in ADT now. So moving into emergency management, Dr. Dingus mentioned several things there. So certainly emergency management's been kind of New World screwworm centric, which is probably a good thing. Unfortunately, it continues to get closer and closer to us. He mentioned that one of the things that's happened is the compliance and movement exercise that we had in Gonzales, Texas. It was an excellent exercise. I want to thank all the staff that participated, not only emergency management for getting that set up, but the training department that was certainly integral in getting that established and rolling. But we all had a lot of staff attend that as well. Region managements, program records attended, legal compliance certainly was there. FD was there, and our IT staff was involved as well. So good agency exercise, taught us several things, and we're working on after action and getting some improvements made and see things as a result of that. So certainly continue to coordinate with USDA and Parks and Wildlife, as was mentioned. Those incident management teams and refinement of that ICS structure is kind of a critical piece that's ongoing, and certainly an important part as we look at having to respond potentially to New World screwworms or anything else. But certainly getting that lined up and working with our partners, not only at Parks and Wildlife, but the SHS, and with our federal partners at Veterinary Services, like the Dr. Dingus mentioned meeting that we're having on Thursday, to help line some of that up on. So here's the first several days and what's that going to look like will be a really valuable exercise. So let's see, other outreach and engagement. Certainly want to thank the EM staff and regional staff that participated in the booths at the livestock markets, providing both English and Spanish information and resources to clients there at those markets has been a great effort and a great, very valuable effort as well. So lastly, on emergency management, for secure food supply planning, just wanted to recognize that in addition to all the work on New World screwworms that they're doing, that we have successfully I say we, they have successfully completed first secure food supply market plan using the THC template, which is also a big part of what's going on nationally. There's a big effort to get some secure food supply market plans put together, and certainly Texas, our staff is leading the way and working on that and sharing those efforts and products with the rest of the country. So very proud of that. We are fully staffed with the secure food supply initiatives. That was a part of the exceptional items that we asked for with some additional positions there, and do have Chance Williamson back with us in that other secure food supply position. So in addition to that, the work continues with the Tri-State Feed Yard Preparedness or Feedlot Preparedness project with Kansas and Colorado. Upcoming events, we've got some staff that will be attending the Texas Emergency Management Conference in May and giving some presentations as well. So, and I bet nobody can guess what the topic will be. Moving into program records, just again, a quick update, and there will be more to come on this as we go along and continue to move through this process. But the transition to electronic certificates of veterinary inspection, ECBIs, that's why I say CBI, instead of other words. January 1st, we put out the notice to the other states that anything coming to Texas needed to be an electronic CBI. February the 1st, we notified everyone in Texas that we're no longer allowing online purchase or ordering of paper CBIs. So that's for the Texas veterinarians. June 1st, we're still on target there to no longer sell paper CBIs at all. And that means that Texas practitioners can continue to use paper CBIs that they have in inventory. They just can't buy more. And then, that puts us in line to continue towards January 1 of next year to make that full transition for Texas practitioners to go electronic with their CBI. So Rebecca's excellent at compiling data and information and certainly shares this with us every month. And so wanted to just put up a little bit of information about what that looks like and highlighted there at the bottom. Is some numbers there for electronic versus paper for imports. And in January, we had about a 13% paper CBI versus electronic CBIs. And then in April, this past month, we're down to just over 8%. So it's creeping down. We've had really good compliance with that. And certainly they're doing a good job helping other states remember that we're no longer accepting paper CBIs, that we have gone electronic, and that effort is certainly being aided and helped by the other states around us that, one, have already gone electronic, and or two, are in the process of going electronic also. So it's not just us, it's a nationwide push to move to electronic CBIs. Last thing about program records and quality assurance, want to recognize Rebecca and her leadership and her team back there as they continue to have folks come on board that do a great job and learn great things and gain lots of knowledge and skills, because that's where a number of our folks have come from to move into other positions, transition into other positions. Examples of that, again, Casey that came into ADT, Jim Cavazos, who came from program records, is now compliance officer. And also we have Chelsea Campbell now that's transitioned to quality assurance. So certainly appreciate all that work and leadership and development back there, and certainly credit to that department and the rest of the agency to have that ability to build some folks and grow some folks into some other positions. Moving into animal health programs, that's just a picture of kind of what our field activities have looked like over the first quarter of the year. So let you kind of peruse that as I give a couple updates related to region offices. As Dr. Dingus referenced several times, our Pleasanton office is up and going. As of April 1st, Beeville was officially closed, and now we have Pleasanton office going. That transition went very smoothly, and certainly appreciate all the work of the region staff and staff services and IT and everybody else is involved with that, comms and getting all the updates made and all of those good things. So appreciate all the work on that. Related to the Willacy sub office, we mentioned that there was a contract that was awarded, I think, at the last commission meeting. They have started construction on that, and they're still on track, they say, to have that ready to go by November the 1st. We'll see. We hope that they're right on that, but that's a pretty ambitious timeline. So we'll see how that goes. Other staffing updates. wanted to certainly recognize and welcome Dr. Munger, Scott Munger, into the role of Sulphur Springs Region Director. I mentioned at the last meeting that Dr. Hayes had retired. Dr. Munger was a field vet up there for a number of years and was transitioned to the role of Region Director. So with that, we've got a number of vacant field veterinary positions open, with especially with Dr. Susan, one of our 2 field vets, transitioning to an epi position. So she's now the epi veterinarian for Stephenville and Amarillo. And so we've got another field vet opening. The good news is maybe we have one that's interested in the position. We'll be interviewing her here in the coming days for either South Texas and/or Giddings. So Pleasanton and/or Giddings, she kind of lives on the line there, and we'll just have to sort through. If she comes on board, we'll sort through where to assign her and best utilize her. So other positions are field staff and inspectors and administrative assistants that seems to remain a lot of interest, or a lot of the interest in those positions remains high. And so there's no hiring issues on that. We have hired 5 temporary livestock inspector positions associated with New World screwworms, and a sub supervisor as well down in Williston County that had help with ectoparasite duties down there. So, which brings me to some really exciting news for us as an agency. We are at a full-time equivalent staffing status of 215 out of 228 positions. And that's the highest we have been in a long, long time, not only in number, but in percentage. And we've got at least 5 more coming on in June. So that is outstanding news. Certainly a credit to our leadership and our management teams in getting those positions, working with our HR team to get those positions posted and filled and through that process, and certainly appreciate all their hard work in getting that done. So a few other field activities I was just going to mention. Dr. Dingus did a great job of kind of updating on the changes in the dispersal, sterile fly dispersal polygons, and what that means for changing traps and relocating that. Very, very excited that we are moving forward and becoming taking on more responsibility here through our livestock inspectors in Laredo region and manning and servicing those traps. Same with being involved with ground release chambers along the river as well. Get to our training in just a minute, but that's certainly an exciting piece and certainly puts us in good stead. I know that other states are aware of our engagement in that with, along with our partners with BS, but I've had some other state veterinary offices reach out and want to send people to start doing some training on trapping and managing those traps. So especially along in the southeast. So that's exciting and certainly very, very valuable experience that we're getting there. So last comment about animal health programs is spent a lot of time talking about New World screwworms, but certainly we have some other things going on. I want to give credit to our staff, our veterinarians and inspection staff in Amarillo and the rest of the state to go up and assist with the big TB tests in those large complexes up there. We completed another big one last week, and we've got some more coming. Unfortunately, we'll be involved with that for a number of years yet. So I certainly want to recognize their efforts in that. That's no small thing to go up there. In addition to, as you can see on the field activities there, we remain very steady and very productive out in the field, getting other surveillance activities and inspections done as well. So I think that's the last slide I've got on there that's got anything. So a couple other comments or updates in our training department. Last meeting introduced Bradley Martin, our director of training, and certainly Donna Mahawkey, who we recognize for her many, many years of dedicated and loyal service, has continued to play an integral part and important part in development and the expansion of that capability for the agency. But we've also put in another field trainer, filled that position. Ms. Megan Fullen is in that position, which is another exceptional item position that we had asked for. So we're one more checked off the list there to get filled. So they've been very busy with New World screwworms, developing guidance documents and SOPs so that we've got those ready to go if we need to use those in a large scale. But certainly their efforts going down to the river and being engaged in the traps and the ground chamber release chambers, ground release chambers, I'll just spit out in a minute, has been good. And they're working on a 5-year training plan that's pretty exciting. It's kind of a new chapter with Animal Health Commission to be that formalized with training. And certainly looking forward to getting that finalized and move forward with those efforts there. So lastly, one other exceptional item, position that we've got filled, Dr. Dan just introduced Dr. Renee Holmes. We're very excited to have her and look forward to reestablishing our robust ectoparasite surveillance programs and certainly having some capacity so that when we need to respond to ectoparasite or pest outbreaks, we have a lot of capacity and expertise. So I think that's everything. I'll quit there. Certainly glad to answer any questions or entertain discussion or anything else if y'all have it. Thank you.
Any questions? Thank you very much, Dr. Good report. Next is presentation of disease information and epidemiology activities, Dr. Timothy Money.
Howdy, y'all. Sorry, I'm gonna sit. My apologies. Everyone can hear me? All right. We'll start with high-pass influenza in livestock. Like Dr. Gingy said, this program is moving right along on a national level as well as for the state. We're doing pretty good. I'm over here, sweetheart. So in the last 30 days, we've remained fine, but also the country is starting to simmer down. USDA's here, they can say anything big, but the important thing is Texas has had 0 cases in a very long time. But we continue to look for it through the National Milk Testing Strategy Program, that 5-pronged plan that USDA put together. So we work with DISH, and DISH has the work agreement for it. To go out and get those samples. We look, and any of them that meet the definition for the program are enrolled every month. And then they go out and inspect and sample if it is qualified for sampling. We've sent in over 1,300 samples from that first year. We started over the calendar year of January, and through January, February, the end of the last quarter, almost 300 samples on top of that. And we are sitting pretty. I don't want to jinx us here at the last minute. But we sent in the annual work plan analysis that showed what we're sampling, all those negatives, and how that related to where and how we're actually producing the milk. So this is the milk that those silos represent. And so with the number of samples, this is what we're looking at. And so we were able to get unaffected status. It's the happiest time I've been to have Texas a random yellow color, but I'll take it, because now we look at everybody else. So like I said, the country's doing pretty good. We're rocking along within that program and finally have reached the status of all of our peers, so no more peer pressure. For cattle tuberculosis, like we've been saying, whole lot of work, but it's a good job that we're doing. And what I like from our field is we just put our head down and get the work done. The entire state is involved in either covering up work in the rest of the regions while the vets all go to the panhandle. And then as more traces pop up, we get the information and we get it handled. So from the federal fiscal year 26, we're still working through the assessment testing on one and testing and remove on another. We have 3 traces that New Mexico has sent over from their positives. And so from the large complex, we're still going through the testing and remove. We just did that. It is a very large effort, but it's looking good. And then we'll do a retest on this beef herd. So they have tested out and they'll qualify and be enrolled for our assurance program. And then we're still doing the assessment of our very large dairy. We're still doing the herd plan for that. What I want might not be what we get from that, but I'll let you know. The first trace out of New Mexico is just a moderate size trace. We were able to get that closed up. The dairy was closed altogether. Then we followed 42 head and got the assessment done for that. So we'll be able to close that out. And then one of those traces was relatively large for a trace. And so the Amarillo region was able to work through that and get all of those tested quicker than I thought that we would be able to. So we've been able to close out those traces that New Mexico generated and shared with us, and we're working back on our herd. So this is where the investigations have been. That beef herd down in Refugio has tested out and will join our assurance testing population. They'll be due in February 2027 through assurance, and so those animal movement restrictions have been lifted. These are assurance testing. We finished out Lipscomb County, so that'll disappear when we roll over, but we've been able to have those two that we tested out, and we just continue the work as we go through, and the Refugio County has been enrolled in that annual assurance testing. So just continuing that work to make sure that we stay free of TB where we've done the regulatory response for it. So we're looking at fiscal year, for everything else, we're looking at through state fiscal year 2. And so through the end of February, we had 24 more trick cases. We usually see a slight uptick this time of year as people test bulls in that part of the state before turning them out. And so this pattern is not very unusual. Actually, it's a little light in some of our heavier counties, so I'll take that as a win, but we're sitting at 37 cases we're responding to so far. And we have one brucellosis suspect that was found at harvest that we're working through. We're actually, this week is week 4, the last week on the assessment phase of doing the test on that population to see if it actually will be status affected. Equine diseases for EIA and pyro. So this matches about what we see every year outside of an outbreak. You can see that we just doubled our EI cases quarter over quarter. Pyro slightly up, and we have no more dual infected horses so far. And so this is where those cases are. For EIA, those are the teal ones, the pyro ones are yellow, and then we have that dual infected horse from the first quarter that is in Williamson County. For the avian diseases, high path AI, Dr. Dindy said for the whole outbreak since 2022, we have the 20 cases. These are the ones from fiscal year 26 that we responded to. One significant one up there, but doing all right, especially considering the continued risk from that with the migratory waterfowl coming over. I don't want to say anything and jinx it. Happy with that. ILT, we continue to monitor and respond to that. So we have 38 cases so far this fiscal year, quarter 1 and quarter 2, and that's localized to the same area where we've been seeing it, and still looking at that uptick we're seeing in a certain region of Texas to see if there is, now that we've defined what the factors are, if there's anything we can do to help decrease the risk there. For our swine diseases, we've got no brucellosis and 5 cases of pseudorabies that we've responded to. So the surveillance program is working there, working through them, and then our cervids. Good news is 155 cases transferred over very recently from the last quarter. So the release sites, the release of facilities that do not qualify for our oversight have been transferred over, and they've been released from our regulatory holds. Owners have been notified, and then we have those same breeder facilities that we've worked through. We continue to monitor those, and as we get positive results reported from the CVMDL or MVSL, we will follow up with them, make sure they don't have any of the species that qualify for our action. And we'll either work with them there. There are a couple we are working through, or we'll just let parks handle that. And then we're working through the cases that we have that we still are managing, even if they still only have native species because of indemnity. So we're working through those case over case and finding the paths that we can recommend to them to get through that program if it's possible through surveillance. This is from our surveillance program. For this last quarter, this is the total 121 samples we have. So this is where we are getting surveillance samples and looking for CWD. And this is the quarter before that. So you would have to put these together to see the area that we're getting surveillance from. I wanted to see the 102 plus the 121 so you can see over time where the different samples are being submitted by the people that are compliant with our surveillance rules versus where CWD is known to have, where in Texas we know the environment has freon contamination because we've detected CWD there, with the free range being teal and the captive or captive plus free range being the yellow or the pink. So that surveillance program, not doing too poorly, focused where it needs to be. Cattle fever tick, we have 43 infested prims as of February that we're managing. And then with exposed, adjacent, and checks associated with that, we have 452 properties that our folks are helping to manage and work through, but also surveil to see what we can do about cattle fever ticks, either keeping the pressure on it so that we keep the infestation where we can't control the risk because of the geographic boundary or because of the nilgai and the wildlife. And so making sure that we keep that constant pressure and eliminate it where we can. You can see the Loop 20 circle after lots and lots and lots and lots and lots and lots and lots of work has been released, though they do continue to watch that and look out for that. So that one that broke through the barrier there, our Laredo region has succeeded in working the program. Lots of surveillance still happening just in case. And then you'll see that infestation area. It looks like that because of some of the factors in there, but trying all we can in a few different methods and monitoring the multiple therapy options to keep that suppressed. And now we have entomologists that has an epi background. So this is, I'm super excited. She says thanks for the to-do list. She won't thank me for long. Foreign animal disease investigation. So we continue to respond and do what we can to make sure that we're protecting our entire state industries and being aware and responding as soon as and appropriately as we can to any reports of suspect foreign animal disease incursions. You can see the number of New World screwworm cases that we sent through that actually got samples sent through for foreign animal disease investigations for Q1 and Q2. So 22 so far. For the fiscal year, Dr. Merle was here, she could say we're over 100 for number of cases for the federal fiscal year. It started last September, but I would say that just means the surveillance program's working and we're looking for it, so we'll find it. It's one of the tricks there to finding it, is looking for it. So any questions?
Thank you very much, Dr. Monty. Next item on the agenda will be a presentation of USDA Veterinary Services Program.
Good morning. Morning, Mr. Chairman, Commissioners. I'm Patricia Collins. I'm the area veterinarian in charge with USDA APHIS Veterinary Services here in Texas. And I'm going to give you first an update on our local office situation and some personnel changes. Then I'm going to update you on some program diseases. Some of the information will be new. Some of it will touch on what you've already heard from Dr. Lansford, Dr. Dinges, and Dr. Monday. And finally, I'll cover some additional information about HPAI and New World screwworm and foreign animal diseases. So in our local office, some staffing changes are happening. We are losing 2 field veterinary medical officers to other positions. USDA has been doing a lot of hiring lately. And so 2 of our folks have taken opportunities in other states. But we are picking up a new veterinary medical graduate from the Texas Tech School in Canyon, and she'll be based out of Randall County. So we're excited to welcome her on later in the summer. We're also picking up 3 animal health technicians, 1 in Brewster County, 1 in Presidio, and 1 in Hidalgo County. These are part of a broader effort that USDA is making to hire personnel to respond to a possible incursion of New World screwworm. Overall, there are about 30 positions advertised for animal health technicians / mounted patrol inspectors. So the cattle fever tick program picked up a few of those. We did, as well as Arizona, California, and New Mexico. So updates on program diseases. The first one I'll talk about is CWD. As you heard from Dr. Monday, activities still continue, and we continue to support CWD activities in captive white-tailed deer in Texas, working with Texas Parks and Wildlife. So since October 1st, 2025, which is the start of our federal fiscal year, we've had 4 new affected captive white-tailed deer breeding herds and 1 release site identified. 1 herd in Mason County was completely depopulated with USDA indemnity of just under 100,000. 2 more of those herds are approved for whole herd depopulation, 1 for about 115,000 and the other for 167,000, and both of those are still in herd plan negotiations. In January this year, a fallow deer in Kansas in a herd there was the first detection of CWD in a fallow deer. And to my knowledge, it's still the only detection. The National Veterinary Services Lab and USDA APHIS purchased the rest of that herd and depopulated it. And to my understanding, they're doing further studies on that herd. So that was a new species with CWD. On the bovine tuberculosis front, you've already heard a lot about that, but I wanted to share that since the start of our fiscal year in October, USDA APHIS has supported the program with about $2.4 million in indemnity for those herds that are under testing plans. All of those trace out animals that you heard of that are indemnified. And there is also a herd that is under consideration right now for whole herd depopulation. And that figure does not include the fund that would support that herd. So we're hopeful that that herd will be depopulated. It's a heavily, the prevalence of tuberculosis in that particular dairy herd is pretty high, and the herd's relatively small by Texas standards. So I think we're going to be able to depopulate that. Moving over to swine pseudorabies, you may have heard that Iowa had the first detection of swine pseudorabies in a commercial herd since 2002. And I'm mentioning that because the swine that were positive in Iowa actually came from a herd in Texas. And that herd in Texas has since been depopulated. The Iowa herd is eligible for quarantine in about 30 days. And as far as the trade impacts go for that detection, for live swine and swine semen, Iowa will still remain a stage 5 or free state for domestic purposes because of the mitigations that they are doing right now to eliminate that. But there are some trade impacts internationally, and I can't go into what they are because each country is different. And my understanding is that it's fairly minimal. And if you need that information, it is available on our website. The APHIS will update that export information daily as that happens. And again, we expect the quarantine to be released and all activities in Iowa to be finished in 30 days or less. On the scrapie eradication program, I'll just mention that you heard Dr. Lansford talking about tagging sheep and goats, and that's also that ADT part is also part of the scrapie eradication program. And APHIS continues to anticipate declaring the United States free of classical scrapie in the next few years. There's only been 1 state that's reported a positive case in the last 7 years. So once we pass that 7-year threshold and have demonstrated to our trading partners that we have met the requirements for surveillance, the United States will join Australia and New Zealand as the only countries in the world that have eradicated scrapie. On that effort, Texas has a quota of about 1,000 samples of both sheep and goats to collect. And I'm happy to say that we have 4 and possibly 5 plants that are collecting samples for us. These are small plants that mostly custom slaughter that collect samples for us. And we budget about close to a little over $250,000 every year for those samples that we collect in Texas. And likewise for bovine spongiform encephalopathy, or BSE, we continue to collect samples in Texas to maintain the United States status for that disease. And our budget here is about $500,000. So those are some of the activities that are kind of always going on in the background. Moving on to foreign animal disease activities, I'm going to give a few different numbers than what Dr. Monday just presented. Total, we have 126 investigations that THC and USDA have jointly either collaborated on or USDA has done, and those range in cases from African swine fever, classical swine fever, foot-mouth disease, vesicular stomatitis, monkeypox. We had a foreign animal disease in a fish reported recently. I'm happy to say all of those were negative except for the fish that was positive. Rabbit hemorrhagic disease, we've had 5 investigations so far this year for that. One of those I think was positive. And then you've already heard about high path influenza. And then the New World screwworm, we continue to get a lot of calls from practitioners and producers with maggots or suspect flies. A large majority of those are companion animal vets with dogs and cats and things. And we've done 106 of those so far this year. Couple updates from APHIS side on avian influenza. You heard it's still 50 states, 1 territory. We're still battling the same thing from February 2022. When I checked the numbers yesterday, it was 2,204 confirmed premises, and nationally 841, which were in non-poultry, meaning backyard type birds. 1,570 control areas have been released. And like you heard earlier, activity is decreasing with the warmer weather. Only 1 detection in the last 7-day period, and that was in North Dakota. On the BCAP side, Texas has slowed down. In fact, we haven't had any biosecurity audit requests since our last meeting, and so no changes there. On the HPAI and dairy cattle, again, a slightly different number. 43 states are now considered unaffected, including Texas, and 4 are provisionally unaffected. And you heard that March 27th of this year, Texas crossed that threshold to be unaffected. So we're very happy about that. But APHIS continues to budget money to support the continued testing, and that is about $288,000 this year. So the bigger outbreak numbers, APHIS has provided more than $4.5 million in direct reimbursement to producers nationally, and that includes 741 affected and 73 unaffected producers from 20 states. Finally, some other updates on New World screwworm, just to add to the excellent overview Dr. Dinges gave. There are about 40 responders currently in the field or supporting this surveillance trapping effort that you heard about. And in addition to hiring those 30-some animal health technicians, APHIS has created a screwworm preparedness and action response coordinator, or SPARC, to coordinate all of this activity that's going on with the surveillance. And I anticipate that that person would then transition into a response role should we have an incursion in the United States. And that is my report. Happy to take any questions.
Any questions? Dr. Collins, thank you very much.
Thank you.
Appreciate you being here. Our next agenda item will be a presentation of an employee engagement survey.
Good
Ms.
morning.
Keeling.
Good morning. My name is Tana Keeling. I'm Director of Human Resources, and it's my pleasure today to present to you the 2026 Survey of Employee Engagement results. Normally, we would send this through another means, but we felt like based on the results, that it was definitely worthy of an agenda item. And so we're going to get you that feedback today. This survey is offered throughout the state to all of the state agencies from the University of Texas Institute of Organizational Excellence. So today I'm going to give you a high-level overview of what this survey is about. And some of you may already be familiar with this, but it's basically to focus on key aspects of the agency to make sure our employees are engaged. And so we want to make sure that we're covering different categories or constructs as the survey refers to them. And so it's basically to check the climate of the agency and the pulse of the agency and how our workforce is doing. And so I want to talk first about our response rate. So in 2024, during the peak of our transition into new leadership and a new organizational structure, the response rate was at 80%. And so we were really excited about this because this was a key point for the agency to get feedback from the employees. So we knew which direction we needed to go, things we needed to strengthen, and all the things we needed to work on. So that was a very effective year for us. And then now in 2026, we had a 74% response rate, and both of those are still considered very high. So we were very pleased with the response from our employees in this. And so when you look at the overall score, it breaks it down into categories. And so above 400 is considered highly engaged workforce. Above 350 is desirable, and then below 300 is a concern. And so as you can see on the right there, the Texas Animal Health Commission scored 414 points, which is considered a highly engaged workforce. We went ahead and compared that to the state agency average. They were able to give me the 2024 data because they're still working on 2026. But in 2024, 401 was the average score. So as you can see, we've exceeded that now in 2026. So we're really excited about that and continue to make sure that we try to keep those levels high. We did want to give you a historical overview of where we've gone since 2015. We pulled some data from way back when, and you can see the trend where things gradually increased. Then it dropped a little bit in 2022. Again, 2024, we rose back up to the 396. And then now we have increased by 18 points to 414 in 2026 survey. I think that has a lot to do with some of the things that our new leadership and our new organization has put into place. And I'll get to those here in just a little bit, but this is definitely something to be proud of. So we're going in the right direction and climbing high. Okay, so when you break down that 414 score, they break it down into what percentage was highly engaged, what percentage was engaged, moderately engaged, or disengaged. And so I'm really happy to report that 42% of our staff are highly engaged in the work that they're doing, which means they're willing to go above and beyond what they normally do in their day of employment. So engaged, we have people who are there in the workplace, they're showing an effort to help out. And then as you can see, moderately engaged, where they're present, but they're probably just kind of doing what they need to do throughout the day. And then we have a few that are disengaged as well. So we're going to continue to work on that so that we can get those percentages where they need to be across the board. This is where we get a little bit more detailed. So the categories that the employees were surveyed on cover anything from the work group to supervision to information systems to pay, benefits, and then their overall engagement. And so one thing I want to point out is that we do see here where pay is below the 300. So we have that on our radar, and I'll dive into that in just a little bit more. But something that I thought was really interesting is that in all of the other constructs, they're all over the 400 mark. So, and I'll just backtrack a little bit. The overall score of 414, I've been in state government and in human resources for going on 29 years, and you do not see a score over 400 very often. So I think that's a testament in itself. And then to see this piece right here where pretty much all of our categories, with the exception of pay, are over 400 as well, means that we're going in the right direction. So we're very happy about that. Pay obviously is going to be one that falls short in a lot of state agencies. This is something that we are concerned about. And so we're going to make sure that we're continuing to give attention to this. Some of the things that leadership has done over the course of time in the last 2 years since the last survey is we have increased our internal promotional opportunities. I think you heard Dr. Lansford talk about how some of the people have been coming from different departments and promoting up to other departments in the agency where we're, harvesting that institutional knowledge. Merit raises for outstanding performance. Our career ladder salary improvements, we just did that again. It was a small bump, but it was nonetheless a bump that we were able to provide with some additional funding that we worked with on our financial services department to help our inspectors get their career ladder levels a little bit higher. Salary equity adjustments. And then we continue to go through a classification review process, making sure that everybody's job description is reflective of the duties that they perform each day and that they are in alignment with the state auditor's office classification series that they have us, help guide us and have us go by to make sure that they're also paid properly for the work that they're doing. And so I want to give you a little bit of a history on how we do look at this for pay. We evaluate the salaries according to, market analysis for our professional settings, so veterinarians, things of that nature. But we also use the state auditor's office. They have a tool that we use where we can actually look at what is the state agency average for certain series. So inspector series, accountant series, things of that nature. And so that helps guide us to see where are we at across the board. Are we right there with them? Do we need to, improve those salaries in a certain aspect? Or are we right there at the average? Are we maxing out? Are we inflated? So we look at all of those things when we're looking at our job titles and what the folks are performing out there for us. So we're going to continue to explore those options that we have available to us to make sure that, if we need to improve those and ask for additional funding through the legislative process, we can do that. But right now, I'm very happy with how we're approaching that. I'm working with leadership and our finance department to make sure that if there are salary dollars, what can we improve on, and then what do we need to stay within our boundaries? Okay, construct changes. So this one gave me a little bit of comfort. Anything on the right side is positive. What the survey will tell us is that anything around 15 points or more is very, very good and something that you should pay attention to. If it's to the left, it would be on the negative side. So thankfully, we don't have anything on the negative side. Everything is on the positive, which means the scores for these individual categories have improved by that many points. So for example, looking at pay, we have improved our score by 37 points, which means our workforce is very well informed and they're very well aware that the agency and that leadership is putting forth their best efforts to make sure that we address this issue and that we try to get everyone paid, equitable and fairly. So does that make sense? Because it's a lot in these surveys to kind of digest, but I thought that was really interesting. So while the overall piece of pay is still low and we want to keep that high up on our radar, I was a little bit comforted that the staff do see that we are trying. So that was a positive piece right there. Moving on to our areas of strength, supervision, our workplace and our work groups. So these are some things that when we took this in 2024, that leadership and we talked about, we wanted to focus on this, make sure that the work environment was beneficial, productive, all of those things to our employees, that they have a workplace that they can come to where they're going to know what their reason is for being here, know how they support the mission, and just kind of educating them on our policies and procedures and the why behind things being done a certain way. And so that has proven to be very effective. Supervision, our managers are getting in there and leading our staff accordingly. All of these validate that the goals we set out to accomplish in 2024 are working. So this was very comforting to see this as well. So we're very happy about that. And then in our areas of concern, as we discussed, pay is high up on the radar. Employee development and benefits, they fell into the areas of concern, but if you look at the scores, they're still over 400. So we're still going to be giving a lot of attention to this, but we were pleased that they're at least in the right segments. Employee development specifically, I am super excited about with this building of our training department. Bradley Martin and I have talked quite a bit about how we can use a learning management system to house all of the trainings that our staff are taking. I know that he's doing a lot of outreach and a plan, if you will, on how can we get these inspectors trained, more depth of knowledge, and then also getting some hands-on experience. And so I think that's going to be really beneficial. So the next time the survey comes around, I'm hoping that number is up as well. Benefits, we have just very little control over benefits. A lot of that is run by the employee retirement system, but we are doing a policy overhaul to make sure that employees are fully aware of what policy benefits are out there for them, whether it be bereavement leave or Family Medical Leave Act and things of that nature. We want to make sure that they're fully aware of it. Okay. And so in going into this, these are the things right here that leadership has promoted with their philosophy. And we put them out there as an HR department as well. We want to make sure we're communicating. We want to make sure we're transparent. Accountability for the work we do, employee growth, as you've heard us talk about, and then communicating expectations. All of this drives our workforce to collaborating as a team to make sure that we're meeting the mission of the agency and serving our industry. So we're very proud of that. And as Dr. Dinges would say, let's make sure we're pulling the rope in the same direction. So that's my favorite line. It works. It works. And, this is the foundation for how we got to where we are today. I think that it's opened up, a lot of new opportunities for us to continue to grow as an agency. And I just want to thank you for your support and recognize Dr. Dinges, Dr. Lansford, the HR staff, all of the department heads and all of the workforce for getting us to this point, because it's definitely something to be proud of. So with that, I hope you find this information helpful, and I'm happy to answer any questions. Yes, sir.
This is the first time I've ever seen anything like this in all the years I've been here. Very, very informative, and thank you for bringing it. I think if we'd have had this a few years ago, we would have avoided a lot of problems.
Understood.
As commissioners. One question I do have, I read what the definition of moderately engaged and disengaged is, and those two percentages add up to 28%. What do you do about that? I mean, if I'm an employer and I've got 28% of my employees that are disengaged and basically holding up the fence and not doing anything else, they're not going to be with me very long.
Right.
So what is the educational or encouragement, whatever?
And that's definitely something that we're actually at that step now, so that we can come together as leadership and talk about what we can do to help those employees be more engaged. Perhaps it's more of an understanding of what their role is and how it affects the big picture, and how they actually get to the point of educating the industry and why their role is so important. I know that's something that we started with. I definitely see that we still have some work to do on that. I think probably getting out into the field a little bit more, working with our managers as well to explain. A lot of times, we get really busy and it's like, let's go do this task and we need to get that done, but they don't really know why they're doing it or the impact of how it's being done and what it's going to affect down the road. And so I think that that's something we can definitely do to help, them understand that they are a piece of this very large picture. And, I know leadership's done a really good job of making sure that it is, one agency, one team, if you will. And so I think we also have new folks on board as well. I think that might have a little bit of something to do with it because they haven't got their feet wet yet. So we do thank Rebecca. Rebecca does have the entry, stomping grounds, if you will, of keeping those staff trained. She does a very good job of informing them, but it is a very fast pace. I think this is the busiest that we've seen the agency in quite some time. So I know everybody's really trying to get out there and get some things done, but I do think it's important to stop and explain, why we're doing this. One of the philosophies I have for the HR department is that, we want to make sure we're educating the workforce on all of the different things that we're responsible for. We also want to make sure we're educating ourselves on the work that they're doing. So it's a trade-off, right? And so I think that going out and being able to participate in different activities is helpful as well. So when we sit down and talk to someone from an HR perspective, we want them to understand, why the policies are written this way, why they have certain benefits. Same thing as when I went out with Rex and, was in a postmortem training and he explained why we're extracting, this from a sheep's head or when we're looking for CWD. And so I think even from the administrative side, it's education all the way around, but also understanding the why. And I know that Dr. Dinges and Dr. Lansford have been incredibly supportive of allowing us to go out and do that. Any opportunity there is, I know that the legal staff have gone out to New World Screwworm training. And so, HR is looking to jump into that as well. So it's, there's not enough hours in the day, it seems like sometimes. But yes, more educational on their why, basically. Any other questions? Okay, this is in your book, so and a detailed executive summary. So if you go through that at a later time and decide that you want to ask me anything, please feel free to reach out.
Thank you very much, Janet. Great report.
Thanks.
Next on the agenda is a presentation of a budget status report from Ms. Paula Andrews. Good morning, ma'am.
Good morning, Chairman, and ladies and gentlemen of the board. Today I will be presenting the operating budget through April 30th. Okay, so I'm going to start with expenses first. They're on the top half of the spreadsheet. Ford Field, total amount that we have expended is $9,856,125. The field budget itself makes up about 72% of all of our budget. It's our biggest strategy, so that makes sense. Of course, the majority of that is spent on salaries. That's about 63% of their total funding. EPI, they expended $403,650. And majority of that is salaries, about 83%. Legal compliance, they expended through April $860,017, and that's about also 83% of salaries. Animal emergency, they expended $236,091, and for their salary, that's about 79% of their total budget that they've expended. Let's see, next is central admin at $1,307,442. And their salaries, again, it's the majority of the expenses, and that's about 75% of total expended. And then it's information technology. They expended $725,342. 75% of it was to salaries. And then last but not least is support services. They expended $203,691, and about 71% of that was salaries. So as you can see, the majority of our expenditures is salaries. It makes up about 66% of the expenditures that we've done through April so far. So with that being said, we have 43% of the budget left, which we have $10,556,507. I'm going to stop right there if there's any questions regarding the expenditures. If not, I will move on to the funding. Down below is the funding summary by method of finance. So far, what we have is 497,222, and that is for the cost recovery. Originally budgeted was 840,000, and so we've already received about 59% of that. Next, we have 184,319, and that's for earned federal funds. And then for federal funds, we have $1,649,549, and that's about 93% of the amount that we are expected to collect or receive. Appropriated receipts, we have 23,420. And then for fleet, this was given to us, we actually UV it in 25, but it's for House Bill 500, and that's 1,290,000. Of course, we have for FE, we have the 30,000 for the aprenomectin trial. And then, of course, for legal, it was 22,590 for the salary increases for the attorneys. I wanted to break down the animal fees, the cost recovery, because it's so important. I'm super excited that we're going electronic. Majority of our ECDIs, it's all ECDIs. So it's about 66% of that 497,000 is electronic certificates. We have about 21% that are like certificates, and then the file is 13%. So I'm super excited that Texas is moving forward to electronic veterinary inspections. Let's see what else. That's all I have. Any questions?
Okay, do I hear a motion to approve the budget status report?
Mr. Chairman, I move that we approve the budget status report as discussed today.
Second.
Okay, we have a motion and a second to approve the report. Is there any discussion or are there any questions? Not all in favor of the motion, signify by saying aye. Aye. Opposed by no. Motion passes unanimously. And the next item is Ms. Paula Andrews again on consideration of and possible action on agency contracts, purchases, and leases.
That's an easy one. We don't have any this time.
That's pretty simple.
Pretty simple, huh?
Okay, so there'll be no action on that item. Well, thank you very much. That was easy. Next item is consideration of and possible action on orders related to commission rule violations. Mr. Jabbar Fahim. Good morning, sir.
Good morning, Chairman. Good morning, Commissioners. Today we have 9 cases that stem from disciplinary orders. 5 are basically dairy ID cases. 2 says TB there, but that's an error. That should be trick. So there are 2 trick violations, and then 2 admin penalties were assessed for EIA and pyro violations. That is stemming from our work at West Texas Racetracks, and we're still doing work and issuing penalties for failure to have a current EIA and pyro test. There's also one final order that is presented for your consideration. This is stemming from an appeal that a producer from Wisconsin filed. They applied for an import permit for reindeer into the state of Texas, and we looked at the rules. There was a case of CWD within 25 miles of that premise in Wisconsin, and based on our rules, we deny import because of that, to protect the state from potential exposure to CWD. This was a reindeer, so it fell within our jurisdiction. And so we had a SO hearing, and we presented our case. Dr. Adams was provided testimony. And the administrative law judge issued a proposal for decision upholding our denial of the import permit. And so that we just need a final order whether to accept or deny the proposal for decision and convert that into a final order. These are all of the orders, including disciplinary and the proposal for decision. And with that, we recommend adoption of the final orders that were presented to you.
Okay, anyone have any questions? Not, do I hear a motion to approve the orders as presented today?
Mr. Chairman, I move that we adopt the final orders from agenda item 14 as presented here today.
Second.
Okay, we have a motion and a second to approve the final orders. Any further discussion or questions? Not, all in favor of the motion signify by saying aye.
Aye.
Opposed by no. The motion passes unanimously. Thank you very much, sir. Next would be Miss Penny Maley. Consideration of and possible action on adoption of proposed rules.
Good morning, I'm Penny Maley. Our rule up for adoption is Chapter 51, entry requirements. Commissioner Payne, last meeting you asked a meeting and I got to rocking and rolling and did a bad job answering it. So before I got too far down the road, I wanted to circle back. You asked last meeting why our CBIs are valid for 30 days and why our permits are only valid for 15 days. So I did a little digging and I've got Rebecca, our program records staff expert, on standby just in case I fumble. So our CBIs are 30 days because that's pretty standard practice across states. Our permits are only valid for 15 days because that time period takes into account similar but a little bit different information than a CBI. So it's looking at a number of things like the type of animal movement, the validity window of the testing that CBI carries, the risk associated with the movement, and it kind of serves as a bridge between movements that really are low risk and have testing windows of like 30 days. So the example Rebecca gave me was like exotics from zoos, for example, move on tests that have longer testing windows, 30-day testing windows, and they represent a lower risk. Where we have other movements that have shorter testing windows like high path, where it's a 72-hour test. So that 15 days was designed to kind of bridge the gap of those movements and then serve as an end date for our staff to close the loop, follow up, and make sure that movement was completed appropriately. So that's why those are two different windows. Perfect. Okay, just wanted to make sure I knocked it out before, again, I got to jamming. So Chapter 51 entry requirements, the purpose of the amendment up for adoption today is to expand the veterinary care permit exception to include cattle, bison, and camelids. This is in addition to our equine that currently have a veterinary care exception. The amendments also eliminate a duplicative exception for equines entering for a sale at a livestock market to first be consigned to a veterinary clinic for issuance of a CBI. So the proposed rule was published in the March 13th issue of the Texas Register for the 30-day comment period. During this window, we received one written comment from the Livestock Marketing Association of Texas. They expressed their support for the rule change, noting the change appears to simplify the process for moving equine interstate and eliminates unintended bureaucratic hassle. The Livestock Marketing Association expressed its appreciation for the Commission's willingness to simplify the requirements. We provided our thanks to the commenter for the feedback. No changes were made as a result of the comment. So with that, staff recommends the Commission adopt the following motion.
Mr. Chairman, I move that we adopt the amendments to Chapter 51, titled entry requirements with changes necessary to the proposed text as published in the March 13, 2026 issue of the Texas Register.
Second. We have a motion and a second to adopt the motion on the proposed rule. Is there any question or discussion? Is there any public comment? Hearing none, all in favor of the motion, please signify by saying aye. Aye. Opposed by no. Motion passes unanimously. Thank you very much.
Thank you.
Next item is, on the agenda is presentation of awards and recognitions. There being none, we'll move to the next one, which is public comment. There being no one signed up, we'll move to the next item, which is adjournment. Thank everyone for being here. We appreciate it. Dr. Collins
Yeah.
got her hand up.
Sorry, Mr. Chairman, I'd like to make a correction, please, and I'd like to thank Mr. Yancey for pointing this out to me. I misspoke earlier about CWD and a new species. It is not fallow deer, it is axis deer in Kansas.
Thank you very much. Well, thank you everyone for being here. We appreciate your attendance. It's great to see everyone, and we will then adjourn.